Hi, my name is Kendra and I give consent to being recorded.
Hi, my name is Karen and I do give consent to being recorded.
Before we begin, I'm going to do a panoramic view of the testing room. Good. Perfect. Okay, Karen, my name is Kendra and I'm going to be your student MP today. Today I'm going to be doing a head-to-toe assessment. Do you have any questions?
No.
Good. I provide privacy and wash my hands. Good. First thing I'm doing is looking at Karen's overall skin, looking that her skin is, appropriate with her ethnicity, and it is. I'm feeling the temperature. Temperature is dry. It's warm. Good. There's no lesions or contusions from what I can see. Now, while I'm here, I'm going to check for capillary refill of her nails. Less than 2 seconds. Very good. Good. And while I'm here, I'm going to feel for her radial pulses. 2 plus, 2 plus. Brachial, 2 plus, 2 plus. Good. Looking at her head is normal cephalic. It's symmetrical. There's no lesions on her head. There's no masses that I can tell. Moving on to her head, I'm feeling for her scalp. Looking at her hair. Scalp is not dry, it's moist. There's no lesions that I can see. There's no bleeding or any flakiness. Her hair is intact. It's moist. Good. No hair distribution issues. Good. Now, Karen, I'm going to move on to your eyes. Looking at Karen's eyes, they're symmetric. There's no drainage that I can see. Her conjunctiva is white. There's no redness. There's no lid lag. Good. Karen, I'm going to have you stand up and read the lowest line on the Snellen chart that you can read.
FELOPZD.
Very good. That's 20/20 vision. I'm going to have you have a seat. Okay. So, if we weren't timed, I would do both eyes, both times looking at the chart. For time purposes, I won't do that. Very good. Karen, I'm going to have you look straight back. I'm going to look into her eyes. Good. Good. Looking at something behind me, Karen. Good. Tell me when you can see my hands coming in your peripherals.
I can see them.
Good. Follow my hand. Good. Cover one eye, please, on your right. Tell me how many fingers.
2. 1. 2. 1.
Good. Now we're going to do the opposite side.
1. 2. 1. 2.
Good. Now I'm going to look into your eye for the red reflex. My left eye to her left eye. Good. Red reflex is present. Red reflex is present. Good. Now moving on to her her ears. Looking at her ears, I'm looking at the skin around her ear. There's no swelling, no exudate, no redness. I'm pressing down on her auricle. Any pain?
No.
Good. Now, because she's an adult, I'm going to press up and back. Left eye to left ear. No swelling. Tympanic membrane is clear. No exudate. Looking at the earwax. No pus noted. Good. Now we're going to do the hearing whispering test. I'm going to have you block this ear, Karen. I'm going to whisper a 2-syllable word. You just have to tell me what I'm whispering, okay?
Yes.
Basketball.
Basketball.
Good. Very good. Now we're going to move on to the nose. Looking at your nose. Feeling for any deviation, any masses, any issues. There's none noted. It's symmetrical with her face. I can feel the air exchange, bilateral patency. Good. Looking for any drainage. There's none. No foreign bodies. No foreign bodies. No bleeding. Good. Now I'm going to feel for her frontal and maxillary sinuses. Any pain, Karen?
No.
Any tenderness?
No.
Good. Eyes, ears, nose. Now we're going to move on to the mouth area. Now I'm looking at her mouth. Her lips are pink. They're symmetric. They're not dry. There's no lesions. They're not cyanotic. Karen, I'm going to have you open your mouth and say, ah. When I'm saying ah, I'm looking at our tonsils, looking at our uvula, looking for any gingivitis, signs of halitosis, looking for her pharynx, any swelling to the tonsils, like I said, any loose teeth. None was noted. I would press on her soft palate on the right for the gag reflex. For testing purposes, I won't do that. Karen, I'm going to have you stick out your tongue. Tongue is pink. It's midline. I'm going to have you lift your tongue up, down, right, left. Any pain?
No.
Good. Tongue has good range of motion. Now, Karen, I'm going to have you press down on your teeth. I'm going to feel for your temporomandibular joint. Good, I can feel it. It's strong. Good. Now I'm going to have you swallow, Karen. Good. Moving on to her neck. I'm feeling her for a gorda, feeling for a trachea deviation. None is noted. No gorda. Feeling for a pharynx. Good. Karen, I'm going to have you shrug your shoulders. Good. Looking at her neck, there's no masses, no lesions. Like I said, everything is symmetrical. Now we're going to do range of motion of your neck, Karen. I'm going to have you put your chin down, chin up, chin right, chin left. Look straight, lean right, lean left. Good range of motion of the neck. Now I'm going to feel for her lymph nodes. Tell me if there's any tenderness, Karen. Any tenderness?
No.
Any tenderness?
No.
No. Her lymph nodes were bean-like. They were mobile. They weren't firm. Good. Now I'm going to move on to her thorax region. Looking at Karen's chest, I'm looking for any use of accessory muscles or any retracting. None is noted. While I'm assessing Karen, I'm looking for her respiration rate. I'm not telling her that I'm doing that because that can interfere with the rate. Looking at her, it's about 17. Very good. Any pain to your chest, Karen?
No.
Good. I'm gonna lean to your back. Any pain?
No.
Good. Say 99.
99, 99, 99,
Good.
99.
No fremitus is noted. Now I'm gonna test for diaphragmatic excursion. I'm gonna palpate your back. I'm gonna have you take a deep breath in, and you're gonna hold it. Let it out. 3 centimeters of diaphragmatic excursion on the left. I'm gonna have you take a deep breath in and hold it again. Let it out. 3 centimeters of diaphragmatic excursion on the right. Bilaterally, they're equal, which is good. Now I'm going to listen to lung sounds. When I'm listening to lung sounds, I'm moving from a right to left to right motion. For testing purposes, I'm not going to listen to it for a full cycle. Breathe regular. Good. No adventitious lung sounds. Lungs sounded normal. Good. Now, Karen, I'm going to have you lay back, please. Head on the pillow supine, which is belly up. Good. Now, moving on to cardiac. Karen, I'm going to have you face your head towards the doors. Good. Looking at Karen's neck, I'm feeling for her carotid. It is felt. I can feel it. Feels no thrills. Now I'm going to listen for any brutes. No brutes are noted. Now we're going to move on to listening to her valves. We're going to do the aortic valve, pulmonic, Erb's point, tricuspid, and the mitral valve. While I'm listening, I'm noting any murmurs that I can hear, and if I can hear a murmur, I would identify it. Listening for S1 and S2. And when I'm listening with both the bell and the diaphragm of my stethoscope. Good. No murmurs were noted. Good. Now we're going to move on to the abdomen. Karen, if you can just bend your knees and place your feet flat on the bed. Good. First thing I'm going to do is look at Karen's abdomen. If I see any pulsations or any signs of herniation, I would note that. I'm looking at her abdomen. I'm going to listen to bowel sounds moving in a clockwise motion. They're not hypo or hyper, they're normal. Now I'm going to feel for the abdominal aorta, which is above the umbilicus. I can feel it. Estimating its size, it's about 2 to 3 centimeters, I would say. Good. Now I'm going to listen to Karen's aortic, iliac, renal, and femoral arteries. Two plus, very good. No hums, good. Now I'm gonna feel for Karen's femoral artery, and while I'm here, I'm gonna feel for her inguinal lymph nodes. They're mobile, bean-shaped, very good. Good. Now I'm going to move on to palpating Karen's abdomen, tympanic all over, some sporadic dullness. Now I'm gonna lightly palpate Karen's abdomen. Any pain, Karen?
No.
Good. Now I'm going to deeply palpate Karen's abdomen. Any pain?
No.
While I'm doing this, I'm noting any abnormal enlargement of the spleen, and I'm also feeling for the liver's border edge. Good. No abnormal signs. Good. Now, Karen, I'm going to have you sit up for me. Now I'm going to assess for CVA tenderness. Karen, tell me if this hurts you.
No. No.
Any pain?
No.
Okay, good. So now we're going to move on to the upper extremities. Karen, if you can please stand up. I'm going to have you stand right here. And I'm going to stand right here. Good. Now we're going to, I'm going to have you lift your arm up. Lean back as far as you can. Good. Any pain?
No.
Bring it down. Good. Now I'm going to have you bring your arm up from the side, over your head, down, crossing your chest. Any pain?
No.
Bring it down. Now I'm going to have you reach your back, trying to touch your shoulder blades. Show the camera. Some limited range of motion. Good. I would make sure to test the opposite side. Good. You can come back. Now we're going to have you lift your arm up. Reach back like you're washing your back with a loofah. Any pain?
No.
Good. You can bring it back down. Good. Now I'm going to have you bring your arm out. Flex for your elbow range of motion. Extend. Supination, pronation. Good. I'm going to have you bring your wrist down. Up. I'm going to have you bring your wrist in. Out. Good. Bring it straight. Good. Make a fist. Out. Bring your fingers in. Bring your fingers out. Good range of motion of the arm, the elbow, the wrist, and the fingers, all intact. Again, for testing purposes, I'm going to do one side, but in reality, I would make sure I would do it on both sides. Very good. Now, Karen, I'm going to have you have a seat, please. Karen, I'm going to have you go like this for me. We're going to test upper body strength. Don't let me push you down. Don't let me push you up. Don't let me push you in. Don't let me push you out. Squeeze my two fingers, please. Put your fingers like this. Don't let me push your thumbs in. Don't let me push your thigh up. Don't let me push your thigh down. Don't let me push your thigh up. Don't push your thigh down. Good. Now we're going to do coordination, Karen. I'm going to have you tap your thighs with your fingers and tap the floor at the same time. Good coordination and good upper body strength. Good. Now, Karen, I'm going to have you stand up, and if you can stand sideways so I can see your back. Good. Now I'm feeling for Karen's spinal processes, noting the curvature, noting for any deformity. None is noted. I'm going to have you face the screen, Karen. I'm going to have you touch your toes as far as you can. Any pain?
No.
Noting the curvature of her back. Lean as far back as you can. Any pain?
No.
Good. Now, Karen, I'm going to have you lean right. Lean left. Turn left. Now turn right. Good. Any pain?
No.
Good. Now I'm going to have you walk to the couch, please. I'm going to have you walk a heel toe. Good. I'm going to have you walk on your tippy toes back to the couch. I'm going to have you walk back. Good. Good gait. Looking at her strike through. It was good. I'm going to have you sit down, please. Now I'm going to have you move on to her hip. I'm going to have you lay back. Good. I'm going to have you put your knee up, flex it all the way up to your chest. Any pain?
No.
Any pain?
No.
Okay, you can relax it down. Now I'm going to have you go into the prone position, Karen, which is belly down. Now I'm going to have you kick your leg up as high as you can. Good. Extension. Good. You can lay back. Any pain there?
No.
All right, lay back, please. Now I'm going to do abduction, adduction, internal rotation, external rotation. Good. Any pain there?
No.
Good. Karen, I'm gonna have you sit up. Now I'm moving on to her knees. I'm looking at her knees. Her knees, there is no swelling. The skin color is appropriate for her ethnicity. There, like I said, no swelling. I'm gonna feel for her popliteal pulses. 2+, 2+, good. Karen, for your range of motion of your knee, I'm gonna have you kick your knee out, in, turn it left, turn it right. Any pain?
No.
Good. And I would make sure to do it on both legs. Now moving on to her lower extremities. Her lower extremities, there's no swelling, no pooling at the ankle. The temperature is warm. Capillary refill for bilateral legs, lower legs is 2+, less than 2 seconds. The hair distribution is equal, good. Skin color is consistent as well. Moving on to her feet, I'm feeling for her dorsal pedis pulses and her posterior tibial pulses. I'm looking at the feet has no swelling. Looking at her toes, capillary refill is less than 2 seconds throughout, good. For your feet, range of motion, Karen, I'm gonna have you put your feet down, up, turn it in, turn it out. Any pain?
No.
I'm gonna have you press down on the gas pedal, up on the gas pedal. Any pain there?
No.
Good. Now we're gonna test lower extremity strength. Don't let me push your thighs out, don't let me push them in. Push your shins out a little bit, Karen. Don't let me push them down, don't let me push them up. Press down on the gas pedal, press up on the gas pedal. Good. Lower extremity strength is normal. Good. Now, Karen, I'm gonna have you stand up, please. I'm gonna have you stare at the screen and I'm gonna have you close your eyes. Good. There's no swaying. Negative Romberg. Now, Karen, I'm gonna have you put your arms out, palms up. Close your eyes. Yep. Good. That's a negative pronator drift. Again, I would do both for 30 seconds, but for time purposes, I won't. Good. You can put it by your side. Good. You can have a seat. Good. Now we're going to move on to, this is going to be sharp. This is dull. You're going to tell me when I poke you, if it's sharp or dull, okay? Close your eyes.
Dull. Dull. Sharp. Sharp. Dull.
Good. Now we're going to move on to 2-point excursion. Karen, I'm going to poke you in 2 different places at the same time. You have to tell me where I'm poking, okay?
Okay. Forehead and wrist.
Correct.
Forehead, wrist, both.
Good. Good. And that's where I did poke. Good. Now I'm going to have you open up your palms, Karen, with your eyes closed. Put your arms like this. I'm going to put an item in your hand and you just have to identify it, okay?
Okay.
Close your hand.
It's coin.
Good. Close your eyes again.
Paper clip.
Good. Now, Karen, I'm going to have you close your eyes. Open up your palm, please. I'm going to write a letter in your palm and you have to tell me what it is, okay?
Okay. Letter A.
Very good, and it was a letter A. Good. So now, Karen, I'm going to have you scoot over and I'm going to test your reflexes. Okay. I'm going to see your arm, please. We're going to bend it. We're going to do the bicep, brachial radial, good. Tricep, good. Do popliteal, good. I'm going to do posterior tibial, good. And they were all 2+, good reflexes, good. And that concludes our video. Thank you.
Thank you.